Okay, you're live.
Good morning. My name is Dr. Melody Keith, and we're here in Lakeway at Lakeway Aquatic Physical Therapy. We're going to be talking about carpal tunnel syndrome. So, for those of you that have wrist and hand pain, I'm going to give you just a few ideas on how to, as I say, make your hands go to the spa or be very nice to your hands. We all know that our hands, our wrists and hands, we do a lot. And here at Lakeway Aquatic Physical Therapy, we are manual therapists, so we're constantly doing things with our hands. And so at times, for those of you that are out there and you get that numbness and tingling, that pain into your hand, or just pain into your joints, you have all that arthritic stuff into the hands and the joints, and it hurts to close them, it hurts to move them, then I'm going to offer some suggestions on what you can do to kind of help your hands. And to me, it's just like, where you're putting oils and lotions on your skin, you should do something special for your hands, especially for those of you that do a lot of repetitive motion and you're crocheting, you're hammering, stuff that you're using your hands a lot. It's nice to give them a little bit of a break. So, first thing that we want to talk about is what we found clinically really helps a lot of our patients is what we call a contrast bath. And so what we've got here is our paraffin wax bath. And you can get those really any place. I do suggest that you get a kind of an upper end unit that has the degrees on how hot it is and things like that, so you take the caution for that. So paraffin wax is wonderful for those of you that have chronic wrist and hand pain. And it gets a very, very deep warmth into the hands. And it feels really, really good, right? So it feels really great. And then we're going to show you how we contrast that with a cold bath. Okay, so here I have Amy, and she's our PTA here. And Amy has her hand in the paraffin, and I'm going to take it off right now and get it. And you can see it, it's kind of just made like a glove for her. And it comes off super easy. And now your hands are super soft. So, and then what we do is immediately we're going to put them in an ice bath. Now, if you see, I've got the bath here. And I didn't put very many ice cubes in it. Again, there's varying degrees of cold. You don't have to kill it. So we're going to keep it in for about 10 or 15 seconds. She's going to take it out, give herself a break because it's pretty painful, right? It's cold. It's cold. Okay? So for those of you that don't want to mess with this, or you're like, oh, there's no way I could do this, you can do moist heat. That's what, this is Mariah. Mariah is our student PTA here, and so she is here. This is moist heat, and so she's had her hand on the moist heat, so now she can do the same thing and dip her hands. She's like, they're really looking forward to this. Dipping your hands into it. And again, we recommend 3 to 4 times, doing it 10 to 15, 20 seconds. Okay, you don't have to sit and if it's really, really painful, really, really burning, just keep it in for a little bit, take it out, dry it off, give it a little bit, then dip it back in 2 or 3 times, right? So the contrast bath, what this does, the pathophysiology of it, it's a vasoconstriction, vasodilation. So it helps with all of that tenderness in here where the carpals, right, all those little bones within your hand get jammed up because of repetitive movements. And so what it does is to help flush out all of that inflammation, all that stuff that is causing either the numbness, tingling, the pain, things like that. And this is something very easy you can try to kind of help with your hand pain. The other ones we're going to give you is just great exercises, and I'll move these out. First ones we just like is just hands onto the table, yep. And you notice we're spreading the fingers nice and wide. And again, you don't have to put a lot of weight. We're not sitting there jamming. Just spreading the fingers. We just open and close, okay? For those of you with hand pain, I don't want you getting your ball and doing this, okay? These are not the muscles we want to work. We're going to work these muscles. We want to get the extensors stronger and help with the movement of the hand. Because we do so much like this, this one is just a good one. And you can do it just for a couple of minutes. You're just opening, closing, right? Abduction, adduction. All right? And then the next one is we're going to come in and kind of work on the wrist. So you're just going to pull them around and stretch. Now, if you're like real tight, you're like, oh, that hurts. You know, so you can see Mariah's a little more flexible. They're a little more flexible. If that hurts, and you notice I want the elbows straight, and you're just going to come in and just kind of stretch so you feel it. Again, hold it about a minute. If it hurts a lot, just do it 5 or 10 seconds, come back, go, ooh, that stretch. So that would tell you that you really need to stretch the flexors and work the extensors, right? So then we're going to come back around into our, so rather than spreading the fingers, now you're just going to try to pick them up. Pick them up. Up, down, up, down, up, down. And you can do this with your elbows bent or with your elbows straight. And if you want to do one set with them straight, one set with them bent, that's beautiful. Again, if you've been using a flexor ball or a stress ball, then my recommendation is to put that down. Don't use that right now because that's only going to add to the carpals being blocked and not moving. So, yeah, those are good. So you've got a few great ideas. Again, we'd love it if you are on Facebook, if you would like us and follow us on Facebook. And if you're on YouTube, please like us and follow us so that you can get more of our series, our Snapinars that we're calling it, integrated medicine, that we're giving you little ideas of things that you can do. Now again, this is not going to solve everybody's hand problems, right? Like shaking them. It's not going to solve everyone's hand problem, but these will be ones that help take care of your hands a little bit, and it may give you some relief. If you need more, then I recommend you see a physical therapist, and we'd love for you to come to Lakeway Aquatic Physical Therapy and join us while we play our hand games. All right? Have a great day. We'll see you again. Bye.